So as we come in, it is 12 o'clock and we are ready to get started. I'm happy to report that this is episode 155 of our Crisis Jam. I'm Dr. Brian Sims, Senior Medical Advisor with the National Association of State Mental Health Program Directors, and I'm honored to be your host for today's session. I'm really thanking everyone who is a part of this service here. This Crisis Jams have just been phenomenal, so I'm honored to be a part of it. Today, we're going to be having a wonderful discussion on 988 polling awareness and trends, and Hannah Wesolowski and Stephanie Pasternak will be giving that talk a little bit later on. So really looking forward to that session coming up. I do want to remind you again of just kind of the housekeeping items. Talk.crisisnow.com is the site that you want to go to so that you can then, if you know of someone who has not yet registered or you have not registered, please do so that you're able to get the resources and the availability to come on to these lines here. There's a lot of material that is already in the site, but also material going forward that you'll be able to see. You'll see that there are a number of things that you can go back and take a look at. You can take a look at last week's session if you so desire, or you can go even further back and look at other sessions that have occurred as well. Now, in the Crisis Jam thus far, as we've said, in over 150 episodes, we've had nearly 400 unique speakers. But even though that may be said, and you see the names and so forth that are scrolling before you, we are still open for ideas. We're still open for suggestions. So please don't hesitate to place your suggestions in the chat box. We'll be happy to work on them and move them forward. Next slide. And this is an interesting article. Had a chance to kind of review this a little while back, but it's an article from the New York Times that talks about something that we're painfully aware of, and that is the youth and playing football and how sometimes the injuries that take place are really, really profound. One of which is this chronic traumatic encephalopathy that can occur with just repeated blows to the head. And we know in football that there's high prevalence with that. I'd ask you to reference this particular article because it is profound, and it's spoken from an individual who then unfortunately committed suicide just after doing this particular video, or saving this video. Also, we're going to take a look through the Washington Post about some suicide rates with regards to 2022 to let us know that the efforts have really begun to be seen. That even though they reached a record high in 2022, they're seeing a drop amongst young people. So this is really our vigil to say, let's keep what we're doing going. Let's ensure that the services that we're providing and the crisis intervention that's given still continues and will always have an impact. Now, this next section, we've had the privilege of being affiliated with what used to be called the International Initiative for Mental Health Leadership. And this is the governing nations that the United States has been a part of for quite a while. This is just to let you know that they have recently launched their new name and website availability. They are now called the Global Leadership Exchange. And this is a combination both of mental health leadership as well as disability leadership. So this is a kind of an announcement per se that it is free to join if you'd like to connect with it. But also when you get on the exchange, what you will see is that they are sponsoring leadership exchanges, and generally they occur every 4 years or so. And they are held in a host nation. So in June of 2024, it's actually going to be held in the Netherlands. So just an update with that. Also, because of COVID and other factors, this will be the first full in-person appearance through the Global Leadership Exchange, or IMHL, since 2019. So this is really a positive move for them. So at this point, we have reached our feature presentation for this morning. And we are honored to have present with us Hannah Wesolowski, the Chief Advocacy Officer, and Stephanie Pasternak, the Director of State Affairs for NAMI, Government Relations, Policy, and Advocacy. And we are thrilled to have you guys with us, and please take it away.
Thank you so much. It's great to be with everyone. And especially with the end of the year coming up, I'm just so grateful for this amazing community that shares knowledge and collaborates. So thank you for having us. I know Stephanie Pasternak is here often in presenting. It's been a bit since I've been on. I'm Hannah Wesolowski, Chief Advocacy Officer at NAMI, and work with many of you, but just so happy to be here. NAMI has been doing some polling over the last few years around 988 awareness, what the public demands around crisis response, what the public actually knows about our current crisis response system. We've done 5 discrete polls since the fall of 2021. Each of them is roughly 2,000 to 3,000 adults in the United States, matches the larger demographic breakup of the United States. So we get a good mix of people. We've done these polls with Ipsos. They're a leading polling firm out there. And 3 of these polls have been exclusive to 988 and crisis response. 2 of them have been on broader mental health, but we always make sure to include 988 and crisis response questions. And just as we gear up for all the work next year, we're really delighted to be here to share some of the insights so that these data points can be leveraged in the work that we're all doing in our communities and at the national level. You know, the big one that we always ask is, how familiar are you with the 988 Suicide and Crisis Lifeline? And we've tracked that, and at first, not very familiar. And over time, we've seen a good jump. Now, a lot of questions we often get: what does awareness, the dark blue line, versus familiarity, the light blue line, mean? So awareness is, people may have heard of 988. They don't necessarily know what it does, but in passing, they may have seen a sign on the metro, they may have seen something else, but they don't really know what it is. Familiarity means that a person excludes the people that may have just heard about it in passing, but it's people who have a general idea of what it might be used for and how it can help them or their family members or friends and loved ones. So familiarity is really what we've been looking at, because we want people to know what this number is for and how they can use it. So we just released our latest polling a couple of weeks ago and found that we've had some growth even from this summer, that 22% of adults are very or somewhat familiar with 988. And about 70% are aware of it. They may have heard of it in passing, but it's really that 22% number that we're zeroing in on. We also found that 29% have never heard of 988. So we have a lot of work to do, but we're also seeing some of that growth thanks to all of the work of the people on this call, that those numbers are continuing to increase on the right trajectory. We've dug into it a little bit more too. So you can see, back in October 2021, before 988 was available nationwide, it was a huge number of never heard of it, and that number is slowly decreasing. So people are starting to hear about 988. We've also found consistently in our polls that youth, really, youth and young adults, particularly 18 to 29-year-olds for adults, and LGBTQ plus Americans are the most familiar with 988, that those continue to be the areas where we have greatest familiarity. It tends to be older adults where we have less familiarity with 988. So when we dig into some of the data, and this is all available on our website, you can get into a lot of those demographics to understand where we have more familiarity, where we have less. So, that's something to be thinking about as we're all trying to get more people across the country familiar with 988 and leverage the great resources available there. You can jump to the next slide. And something else that we found, and this was from polling we did in the summer. So we'll be jumping back and forth with our most recent polling, which included 988, but other things as well as one we did exclusively on 988 and crisis response in June. This is from June, and we really wanted to see, okay, if people know about 988, what do they know about it? And we found that unfortunately, most people don't understand the basic facts of 988. Only about 1 in 5 people got more than half of the questions correct. So you can kind of see here, digging into this, that people don't necessarily, they either don't know and didn't answer, or they might think the wrong thing. They might think that generally, if you call 988, you're gonna get an in-person response, or that you're going to go to the hospital, or the police are gonna respond, or it's only for suicidal ideation. So we do have a lot of education to do in terms of what to expect when you reach out to 988 for help. And so digging into this data has been really useful in terms of addressing some of the myths and misperceptions around 988. And I'm going to turn it over to my colleague Steph to dig in a little bit on some of the funding and financing, which I know is a hot topic on this call and a hot topic in the community. Steph?
Yeah, thanks, Hannah. Great to be with you all. So we wanted to talk about how does the public see 988 in terms of funding priorities. We asked about various items that may receive federal funding. How much of a priority, if at all, should Congress place on funding each of the following? And the 988 Lifeline was one of those options given. So in June, we saw 50% of respondents say that the 988 should be the highest or a high priority for Congress. And then when we asked this question again in the fall, the percentage of people saying it should be a high or highest priority actually increased by 7 points to 57%. So put another way, over half of Americans say that funding the 988 Suicide and Crisis Lifeline should be a high or the highest priority for Congress. And breaking this down demographically a bit, we also found that Black and Hispanic Americans were more likely than white Americans to say that 988 should be the highest priority for federal funding. And just some other quick data points from our June 2023 survey. Sorry, May is a typo there. But we also asked folks, taking into account everything you know about mental health, alcohol and drug problems, and suicide crises, how much would you support or oppose policies that support creating what we would now recognize as a 988 call center? So 24/7 mental health, alcohol and drug suicide crisis centers that can respond effectively to callers and follow up later. That was at 90%. Require all health insurers to cover mental health crisis services was at 88% support. And we actually saw this figure go up in our more recent poll, which I'll cover. And also provide state funding to support the Lifeline. That was an 84% support figure. And we can jump to the next slide. So we've also asked people what they thought about 988 telecommunications fees. I know we have mentioned many times on the jam here that 988 fees, which are small charges on residents' monthly phone bills, are an important and sustainable funding option that states can choose to use to help fund their 988 programs. And that option was offered through the federal 988 law. Now, I know there's a lot on this slide, but breaking it down a bit, we found that 3 in 4 Americans are willing to pay a 988 fee. And that support grows, and the amount that people are willing to pay increases after hearing what Americans already pay on average for 911 services. So we found that 42% of Americans are willing to pay 50 cents or more on a monthly fee to fund crisis services before hearing that Americans on average pay $1 per month in 911 fees. And then after they learn about 911 fees, 56% of Americans are willing to pay 50 cents or more. Can jump to the next slide. And we also just found throughout the poll that the public overwhelmingly supports crisis care. Starting on the left, 1 in 2 people say that significant improvement is needed when it comes to an emergency response to mental health or suicide crisis. We also asked this for drug and alcohol crises, and that figure was 2 in 5. 87% of people support support Congress funding research that would seek to identify risks for suicide and improve suicide prevention. And at NAMI, we've also been making the point that insurers need to pay their fair share of crisis care services. And we also see that kind of support reflected in this poll. So this is the increase from 88%. In our more recent poll, 91% of Americans agree that health insurance should cover mental health crisis services. And 7 in 10 strongly agree that all health insurance should cover mental health crisis services, which is up 11 points from late 2022. And I will flip it back to Hannah.
Yeah, thanks, Steph. And I see some of the questions about our audience, which we answered in the chat, and state level analysis. State level analysis is where we're going. We have not had, for only some states, we've been able to have enough responses to dig in to state level data. It's been, you know, for some states, there's not enough respondents that you can draw conclusions, but that's kind of the next wave of where we're going and hoping to get this so that we can continue to track at a national level, but also dig into some of the most appropriate state level data. You know, one of the questions we wanted to know, especially since this was targeted towards the general population, is what do people think happens now when somebody is in crisis? If you haven't been in this space, if you haven't needed that type of response, you know, a lot of people may not know what actually happens, that we've leaned on law enforcement, that there have been tragic outcomes. You know, so we've had asked consistently, and this is from our summer polling, you know, would you want somebody in crisis to have a mental health response or a police response? And consistently and increasingly in every poll, people overwhelmingly say that a person in crisis should have that mental health response, not a police response. And we think that's important for messaging to policymakers to continue to lean on developing the rest of the crisis continuum of care. And, you know, we also asked if people would, and we can actually jump to the next slide because it digs into this in a little bit more of a graphic way. Would you be afraid that if you called 911 for help for a loved one in crisis about that response? Again, knowing that people know 911 and don't yet know 988, how do they feel? And we saw very strong you know, demographic differences around some of these. You know, overwhelmingly, people had concerns about calling 911 and what would happen if law enforcement responded, but certainly Black and Hispanic respondents and LGBTQ+ respondents had more significant concerns about what would happen for them and their loved one. So again, when talking about equity in our system and equity in our response, you know, this is based on people's real life experiences and their perceptions of how it would impact them. Something we need to be really mindful of in building out a system that's equitable and provides safe, equitable responses for everyone. Steph, I'll turn it back over to you.
And so we also wanted to find out what factors would make someone more likely to reach out to 988 for help. So we asked, to what extent, if at all, would each of the following make you more or less likely to call 988 for yourself or another person in a mental health, substance use, or suicide crisis? And you can see a number of factors listed in each bar below. And bottom line, we found that the most important factor to encourage calling 988 was the speed of the response, being able to speak with a counselor immediately, followed by not receiving a bill for the call and ensuring that healthcare professionals arrive first. And we saw these answers be kind of consistent across all major demographic groups. And we can go to the next slide. Okay, so let's talk for just a quick minute about geo-routing. So right now, when folks contact 988, they are directed to their nearest local call center based on their phone's area code rather than actual location. And because of this, we wanted to know how much do people's phone numbers match where they live. So first we asked, if you contacted 988, how would you do so? And 77% said they'd use their cell phone. However, only 74% of folks said their mobile phone area code matched the state that they currently live in. And only 64% said that their area code matched the local area they lived in. So that tells us there is a lot of location mismatch right now out there. And we can jump to our final slides, and I will toss it back to Hannah to wrap us up.
Thanks, Steph. And I'd be remiss, our colleague Brandon is responding to some of the questions in the chat, and Brandon is the mastermind behind all of this and has really been pushing these efforts forward. So thank you, Brandon. Just some key takeaways, familiarity, we have a long way to go. We see even just from June to October this year, a good bump in familiarity with 988, but still a lot of people have never heard of 988. And I was just up on Capitol Hill talking to a member of Congress that I thought would be supportive who also had not heard of 988. So just a reminder that we have a lot of education to do across the board on this resource. There's really a need to educate the public about what 988 offers. Again, people need to trust the system that they are being asked to rely on. And so part of that trust is really explaining what 988 offers to them, what that response looks like, what they can expect. Also, regardless of party affiliation, which I think speaks to the bipartisanship around mental health, people want Congress to do more around mental health. Specifically, there's been interest and really high polling numbers around Congress prioritizing funding for 988 and suicide prevention programs. So I think that's really good data that we're bringing to Capitol Hill to continue the funding and support that they have been so generous with, but that we know we need more of moving forward. And if we can go to the next slide, please. And, we see that there is broad support, even if people themselves have not had experiences with a mental health crisis, there is broad support that this be available to everyone. We need to continue to educate the public about what this system that we all want looks like, so that everyone can be putting pressure. We need to make sure that everyone knows that this continuum requires several things, not just 988, and really increase that education, not just of our public policy leaders, but also of the general public, so they can continue to demand that we have this full continuum of crisis care in every community. And part of that as well is making sure that this crisis care is covered by insurance so that we can sustainably provide it. And then finally, people want to access 988 quickly, which the data is showing us is happening. But again, we need to communicate that to people. Again, what to expect. And, we had just a call yesterday, NAMI, and there were a lot of questions of, will somebody come to my house if I call? How will they have my information? So reinforcing the anonymity this is a resource, this is somebody you can talk to, and what to expect if there is a more substantial crisis that needs a response. A lot of education for us to do, but it's really great to see that this community is moving the mark and continuing to build awareness around 988. So we hope this data is helpful. On the next slide, there's links, we'll drop them in the chat of where you can find all of this data. Please feel free to reach out to us. I'm sure all of you know how to reach Steph or myself, but we always love discussing this and really grateful for the work that this community does.
Wow. Thank you. Thank you for that wealth of information. I know it was pretty tough on you to have all of that data at one point, but NAMI, you guys are just spectacular. Just in taking a look at what is out there, having a finger on the pulse, and probably most impressive, how you were able to do real-time response to the chat questions. That's a multitasking thing that this grandfather can't handle, but just wonderfully how you're able to give those pieces. I did have one quick question because I want to jump quickly into the roundtable discussion. In your data, is there data that shows potentially misconceptions about 988 and what percentage that might be? Because I'm looking in particular at like marginalized communities where 988 and 911 are so similar in their perspectives. Is there any data to kind of show that percentage?
Yeah, that's a good question. So some of the kind of information that people didn't get right, we do have that demographic data. So based on kind of what are some of those misperceptions based on community,
Mhm.
some of that is, you know, that the police will come, that it's not anonymous.
Right.
So I don't have that on the tip of my brain right now, but I'm happy to share that and follow up with folks who are interested. Um, but you know, it does vary by community what people think is going to happen, that I think very much closely maps with a lot of the trauma and tragedy that we have seen so consistently across the country. So it's a great question. Happy to follow up with that.
Thank you. Thank you. I'm going to move to the roundtable now. We have Stephanie Mitchell-Hughes with us, Assistant Director out of NAMI in Franklin County, and your feedback, Stephanie. I think you have to come off mute, my dear.
Okay. All right. I think that it is spot on. That is what my response would be, is that it is absolutely spot on. This is a very heavy lift. And 911, when you compare how long it took for 911 to become a household word, we've got an all hands on deck for 988. That is what we are going to have, because the challenge is, if we are able to get within states and localities laws and some funding passed, then we have to, in order to sustain it, we've got to also show people how to scale up and really what it is going to cost to do that. And that is something that in Ohio, I believe that we are wrestling with part of that right now, and looking at how we can ensure that the funding is sustainable, but it also is an all hands on deck activity, meaning that every one of us has a responsibility to talk about, raise, ask questions, etc., in order to ensure that 988 is in our community and that it is sustainable, so that people can get the help that we need. So I spot on, and I applaud Stephanie and Hannah. I applaud you. Outstanding, spot on. Take that information and go back to your communities and share it and spread it.
Stephanie, thank you so much. And that message was made very clear, I'm sure, but reflective of what's in the chat box, it's very evident that this is a follow-up and a follow-through component.
Mm-hmm.
I'm wondering if we have, and thank you again, Stephanie. If we have
Sure.
Rosen, manager out of federal policy with the American Foundation of Suicide Prevention. Your comments, Joanna.
Yeah, thank you so much. And obviously huge thank you to Hannah and Stephanie and everyone at NAMI for running this poll and sharing out these results. I think overwhelmingly, I feel really good about pretty much all of the results that have been shared out. Obviously, there are elements for improvement. There are areas that we can work on expanding. And as Stephanie just spoke to, I think the funding is really critical, and the only way that we can keep up this great performance and keep raising awareness is by getting a lot of federal funding as well as state funding for 988. And I think that is something that, you know, I know us at AFSP and at NAMI and, you know, Vibrant, we're all working on that year round really. But I think the location service aspect is something that I know I find really interesting given our work at AFSP. And I know NAMI is also working on some geo-routing and geolocation legislation and exploring that area. And, you know, just the fact that, you know, 3/4 of people who reach out to 988 are doing so through cell phones. But, you know, only about 74% of people have cell phone area codes that match the area that they live in. I think that that's really critical. And, you know, you might not think that that's a large number, but that's about 1/4 of the people who are reaching out whose area codes don't match the local call centers that are close to them. And I think, an element of the crisis care continuum that, when we're talking to people who aren't familiar, an element that they're not aware of is the fact that we really need to be able to link up those services and the follow-up care after a call to a crisis line, and making sure that those resources are available and that the call centers have that knowledge of the resources that are around them, so that that can be provided to the callers, even if it's just information, if it's not, a handoff or anything, just making sure that they have swift, accessible, easy to understand information around the communities that they're trying to service is really, really critical. And I think, this sort of backs up the need for that focus and the need for that expansion of better, more accurate geo connections. And I think, the anonymity portion as well is really important, as Brian, you had spoke to, that question about 911 versus 988 and a lot of the misconceptions around how the two different phone lines interact and share information. And I think, as Hannah mentioned, it's a key concern and a priority for callers is the privacy and anonymity. So making sure that the location services are as sustained as possible and as local as possible, while still being private and anonymous, is really, really important. So I think these results really just drive that home, and I'm excited to keep working on this with NAMI and with everyone. But I think that's all I have to say. Thank you, Brian.
No, thank you, Joanna. And I think what we can carry from this is that what we're seeing is that the movement is actually moving in a very positive direction. But what I like about everything that everyone has said, Stephanie, Joanna, but as well going back to looking at what Hannah and Stephanie have said earlier, this is an ongoing process. And I think that's relevant, and it's very important in looking at the theme, is that we're not simply looking at a static situation and deciding that this is the picture of it today. We're looking at the picture today and how we can make movements to improve it, move it forward. So thank you to each and every one of you. Just phenomenal in terms of the delivery of information in such a short period of time, but also very encouraging about where 988 is going, both for those who receive services, but also for those who deliver the service. So thank you all again, and thank you for being a part of this discussion. So we're going to move next to the trivia hot seat for today. And actually today we're going to do it as an audience participation crisis hot seat. And actually, if you would like, as an audience, someone could come off and actually poll an individual if you so choose or want to choose someone. But let's just put this out there to the audience. And this comes from the vault out of February of 2022. And it's generally accepted that the decision to utilize 911 was born out of simplicity. The 3 digits are an easy number to remember. But what about 988? So the question that we have for today is the FCC Commissioner Ajit Pai heard requests for 611 and 211, but believed that 988 was better because, and you have choices: A, 988 was available; B, 9 indicates emergency; C, parallelism with 911; or D, all of the above. So as an audience, you can get together. Your poll should be on the screen if you will answer out. Let's see how we do today. We should have some numbers coming up pretty soon. And wow, what an audience. We have overwhelmingly 90%. I don't think I've seen it this high before, that it is potentially all of the above. And the correct answer is indeed all of the above. We have such a sharp audience today. So the FCC created that piece for the 2 most important numbers in the US to be 911 and 988. so that way you could look at public safety, medical emergencies, or suicide and behavioral health crises. So the FCC kind of born those numbers to put it all together, even though other numbers were being described. So sharp audience. I wish I could say other than thank you and kudos to everybody in the audience that we could do something else. How about this? I'll just say to you all very special happy holidays. Thank you for the participation in that. Okay, I want to move now to a quote, and this is a pretty profound quote. It actually comes from an individual who was part of a focus group, a person with lived experience when there was a South Georgia crisis and access line implementation study. And the quote is simple, but very, very open. Services have been organized around your Monday through Friday, 8 a.m. to 5 p.m. convenience, not ours, but a reminder that a crisis has no schedule. I've seen this and I've heard this from many individuals receiving services before. This is a reminder to each and every one of us that as we deliver care, keep that perspective in mind, that a crisis can occur, and also to keep in mind that a crisis can be whatever the person defines as a crisis. Next slide, please. We are now ready to go into our SAMHSA update for today, and we have with us Brandon Johnson with the branch chief, who's branch chief of Suicide Prevention Branch with the Division of Suicide Prevention and Community Supports with SAMHSA and CMHS. So Brandon, if you're available, if you will come off and provide us with the SAMHSA update, please. Okay. And I am not seeing Brandon come through. So maybe Brandon, while you're working your way up, if it's okay, we can come back to you if you come back in. But let's move to our NASPID update. And we have with us Dr. Brian Hepburn. Dr. Hepburn, if you would provide it, sir.
Thank you, Dr. Sims, and I want to thank the presenters today. I think that the data really reflects a lot of the work that's been going on and the attention to 988 and crisis services. So I want to thank the presenters and the audience as well. I just wanted to say briefly that that SAMHSA put out a nice document on November 27th, supporting your mental health during the holiday season. And they reference how the holidays can be a time of celebration and joy for many, but also it can be a time of stress, sadness, and loneliness. And they reference a NAMI, the NAMI data that talks about 65% of individuals living with mental illness reporting that their conditions worsened around the holidays. So I think it's a nice article. It talks about what to do to help yourself, what to do to help others, practicing self-care, connecting with the community, supporting others. So I just wanted to bring this to your attention. I know, as Dr. Sim said, this is the last session for the year. It's a time to reflect on all that's been accomplished over the year and to thank everyone. But also, we want to wish you a happy holiday season and to take care of yourself. Take a look at this article, and we hope that we can all get together and have a great 2024. So thank you very much, and best wishes.
Thank you, Brian, as always, and thanks as well to SAMHSA for the incredible efforts that have taken place. I'm going to keep it on this slide if you don't mind, just as a reminder to you that, again, we've had some wonderful responses from the state in terms of topic areas, but I do want to point out that those darkened areas with the black and white ones are states that we would love to hear more information about some of the initiatives, some of the things that you're doing that you'd love to have highlighted. We would be happy to place it in those particular spots. So get back with your particular states if you're listed on the screen and just let us know what great things you're doing. I know you're doing great things because I'm looking at a couple of the states there and I know that there's some phenomenal things. I'm going to go back, if you will. I don't see Brandon on the line. I'm just going to ask Dr. McKeon, if you are on, sir, if you would come and possibly give some SAMHSA updates for us and put you on the spot, sir. But
I would be glad to.
Thank you.
So Some of you may be aware that that the 988 office has launched a number of different office hours in order to be able to get the word out and have a chance to answer people's questions around key issues. Obviously, the crisis jam is a major way for us to get the word out. And I love how often the important questions come up in the chat, but we're really looking to supplement that as well. So, you know, we will be, if you haven't seen it already, we'll be, you know, providing how that can be accessed by key stakeholder groups. And certainly if anybody wants more information, they can feel free to email me at richard.mckeon, MCKEON, at samhsa.hhs.gov. Also, just mentioned yesterday, I was at a meeting hosted by ACF, which is one of the operating divisions at HHS, which was, I thought, very useful. It was a meeting of all federally supported hotlines with their, that particularly with a focus on youth, with their federal sponsor and the grantee or contractor who was actually providing the hotline. Or so I thought it was particularly useful because there's a youth runaway line, there's youth homelessness. And then there are others like 988, which cover a variety of, across the age range, but certainly include youth. So for example, the National Domestic Violence Hotline. So as we can continue to move forward with 988, being able to link to this wealth of other federally supported resources is particularly important. And of course, specifically around youth, one of the things that I would emphasize is how our text and chat services in particular are used much more frequently by youth, and those who access chat and text are more likely to have current suicidal thoughts. So particularly important information. So, you know, so thank you for giving me the opportunity to hop on, whatever.
Well, Dr. McKeon, no, thank you for that incredible information. I mean, that is just phenomenal. In that regard, we had talked a little bit earlier about the young folks and the messages behind it. I think that's another reminder to us of how powerful it is that they are connected, but number one, two, that they're able to get the message out to others. So thank you so much for that. We are now ready to move to, I see our Tech Corner. And we have with us at our Tech Corner, Dr. Dave Atkins. And Dr. Atkins, take your time, sir, but if you'll give us a little background and a little of what you wish to talk about today.
Absolutely. It is really my great pleasure to be here. I am a clinical psychologist by background, have been focused on developing technologies, AI-focused technologies for the last 15 years, first within the University of Washington and now at Listen, which is a tech startup. And really excited to be here. David asked if I would have an occasional tech corner. And so hoping to touch on technology and AI that is both directly related to crisis and also larger issues in the culture. And as today, we're gonna be talking about the federal government. And so would absolutely welcome folks, both questions as well as ideas for future tech corners, as we're hoping to do this maybe every 4 to 6 weeks. Today, we are going to talk about, excuse me, the executive order from the Biden administration giving guidance on artificial intelligence. So first, if you were not aware that there has been an executive order, there has been in October. And one thing to emphasize up front is that this is early days. There's a lot of AI advancement happening in the last year. courtesy in particular of ChatGPT, and governments, not only here in the US, but also in the European Union, are working towards getting regulations in place. This is an executive order, not federal law, meaning that the Biden administration has given guidance to the executive branch. So that includes everything from Homeland Security to Health and Human Services, the National Institute for Standards and Technologies. So it is a very broad topic, and there are 8 particular pillars that get called out in this executive order. One of the other things to know and to realize is that this is essentially a request that each of these agencies develop guidelines and regulations. So in terms of what the actual specific impact will be, we'll know a whole lot more by the time we get to July 2024. If I could have the next slide. But I think we can see from how the executive order is described and the principles and kind of key guideposts that are included, we can take some guesses as to what likely will get included. So specific related to health and healthcare, there is certainly an emphasis on the sensitivity of patient and client data and additional oversight related to AI and its use of data. It's important to keep in mind that we have a federal law in HIPAA, and there is clear guidance from the FDA that any technology that would either diagnose or directly provide care would have to go through the formal FDA process. So we already have some things in place. But we will, in all likelihood, see additional specific to AI regulations around how AI can and cannot be used directly in services. A huge piece of AI regulations, both here in the US as well as in the EU, relate to transparency. AI can reasonably be described as a black box. And so how do we open that black box? How do we actually describe how AI was developed, by whom, and with what data, which can be incredibly important related to anti-bias and equity. Another key thing related to transparency is being incredibly transparent about when something is AI. As many of you likely have seen, AI is becoming more and more lifelike in its ability to generate text, generate images, generate video. And so there is almost certainly going to be clear guidance around being clear and labeling and communicating when something is AI generated and not actually a real human. And then finally, the third bullet point just commenting on here is around equity and anti-bias. Again, we're kind of guessing at what will get in place in terms of these guidelines right now, but almost certainly it will be some demonstration and validation of AI-based tools across diverse populations, almost certainly some type of continuous quality improvement so that there is an ongoing monitoring of potential bias related to AI and its accuracy across diverse populations, and as needed, the ability to calibrate and update that technology. Next slide, please. So this executive order is very far-reaching, and this is really just a thumbnail sketch. If you would like to see a little bit more, the Wiley law firm, who I have absolutely no connection to, but Google helped us find, they have a really nice summary, and so have that link there. If you'd like to hear a little bit more of the actual narrative and story of how the AI executive order came to be, Politico did a nice article kind of highlighting Bruce Reed, and who was really the main policy driver behind this. And finally, this is not specific to the executive order, but the Coalition for Health AI, or CHAI, is a really great resource for thinking about how AI regulations and standards would apply specifically to healthcare. They seem to be setting themselves up perhaps to be a type of accrediting body for AI's use within healthcare. And I've been very impressed with the thoroughness of how they're going about developing their own guidelines and best practices. So thank you so much for allowing me to be here, and look forward to future Tech Corners.
Well, thank you so much, Dr. Atkins, and thank you for through with the Tech Corner development. I think this is something that's very timely now, with AI becoming more of a focus. So we'll look forward to future information as well. So I want to move now to our federal updates, and we have with us Joanna Rosen, who will bring us the updates for today. So back to you, Joanna.
I'm back. Thank you, Brian. So for federal updates, this is going to be very, very quick. We're still waiting on any budget news beyond the current laddered CR that's keeping portions of the government operating through January and February. The Senate Health, Education, Labor, and Pension Committee did hold a session yesterday where they reported out several health and education bills. Among those, the biggest of which that sort of pertains to our area of interest is the Support Act reauthorization. There weren't many, apologies for the noise. There weren't many crisis care provisions that were included, but there were several amendments that were mentioned. A few were withdrawn that pertain to telehealth, access to care, and workforce expansion for mental health and substance use treatment. So I think those are all areas that we'll see going into 2024 that will get a lot of attention on the Hill, and we're looking forward to hopefully making some strides on some 988 legislation as we move forward in the next year. But that's all I have. Thank you.
Wow, Ryan. In that short period, I want to thank you for that information, but you mentioned three things that I really wanted to just kind of highlight, if you don't mind, bringing them back up again, that the legislation is currently talking about issues that are really striking us really big time. Telehealth being one of them. You also mentioned about access to care, huge issue. And as well, looking at workforce. There isn't a state we don't talk to that doesn't have workforce issues. So we're really looking forward to where those issues are going. And thanks again for that information, which is incredible.
Of course. Thank you.
All righty. We'll move now next to our crisis talk. And we have Stephanie Hepburn with us today.
Thanks, Dr. Sim.
So to you, Stephanie.
Thank you. So I'd like to welcome Lindsay Stone. She's the CNY Mental Health Programming Director at the McNabb Center in Tennessee. Lindsay, you've recently done a presentation for us on the Family Walk-In Center and the Crisis Stabilization Unit. I was wondering if you could take a step back, because you gave us a good step-by-step breakdown in the article. And if you could give the participants just a little step back in terms of how you built that partnership with East Tennessee Children's Hospital.
Sure. Well, one of the things that I talked to Stephanie a lot when we did this crisis talk interview is that it was really a ripple effect of starting with something and then developing from there. So back in around 2016, we started talking to East Tennessee Children's Hospital because they were noticing an increase in their boarding times for behavioral health patients. And they were noticing that they were getting even more admits of behavioral health patients. And they really came to us and said, we're a medical hospital, like we don't focus in behavioral health. And us being a community mental health center where that is our expertise, like we kind of joined with them in that shared decision making of like, how can we come alongside you in that? So just a real quick timeline, we started with kind of what we call curbside consultations, putting our psychiatrists on the phone with their providers in the ED to consult with them on behavioral health medications to kind of help some of those transitions to other levels of care. That evolved into us actually bringing the psychiatrists and our staff onto the floor of the ED about a year later, 5 days a week to actually do consultations in the ED. That then evolved into a conversation, again, because all of these things were successful and we were seeing kind of the needle move to addressing those behavioral health needs, to going into 14 of their primary care practices from a telehealth perspective to do mental health assessments on the PCP side for them to address it in the outpatient side. Then that developed into like, hey, we need more options for kids to be able to go to an outpatient center immediately. And so then we opened our walk-in center, and they refer a lot to the walk-in center, and we're able to divert a lot from our children's crisis walk-in center. And then in the midst of that, we opened our children's crisis stabilization unit located on the 4th floor of East Tennessee Children's Hospital. So the children's CSU continues to be a big part of our partnership, but it would not have happened without that timeline of addressing some of the other needs and then strengthening that partnership along the way. So it's definitely been a ripple effect, is what I always say.
If you don't mind just spotlighting a little bit about some of the stats for the crisis stabilization unit.
Yeah. So right now we just hit over 600 kids served just in about 18 months of service. And one of our biggest kind of outcomes is just a diversion rate. We wanted to be able to show that that level of care was working because we did not have it in Tennessee prior to us opening it. So we continue to maintain a 92% diversion rate. So really keeping kids at that level of care and in outpatient care. We have a high level of family engagement. We continue to have 99% of families engaged during their treatment, which we know is a protective factor when they leave the unit to set them up for success and support after that. And we technically still have, one of the big things is that we're not bound to a 72-hour stay. And so we're really averaging still about 5 days, sometimes a little bit longer, but we still have that flexibility, thankfully, in the state of Tennessee for kids to be able to allow them to stay to a point of stabilization. And so those are some of the big things that we're still seeing as big successes.
And there's also a thread of continuity also because the records, somebody, can you explain just really quickly what that looks like?
Sure. Well, one of the things that we have benefited with in our partnership is that the electronic medical record that they use in the ED downstairs, our psychiatrists have access to that. So if it is a kid that comes up from the ED, we have kind of that shared record process with them. And so we have kind of feedback loops, even with our crisis walk-in center, to go back to the ED staff, their social work department. So if that kid does come back to the ED or they have a touch point with them again, there's really just all that collaboration, both in the record sense and just the communication standpoint. And all of that has just come out of just the good partnership that we've had.
Thank you so much, Lindsay. I'll pass it back to you, Dr. Sims.
Wow. Well, before you guys disappear, number one, thank you so much for that. But also, Lindsay, I just wanted to just relate to everyone. When you go back and review the slide, just want everyone to see that quotation that you made in the slide. The partnerships don't come out of the blue. They're built over time. That is more profound than you could ever imagine. When we look at systems and development of relationships and collaborations, there's this, what we would refer to as a rush to wellness, that sometimes we're a little impatient about making those connections, making those partnerships, but how important it is to stick with it and develop it over time because it's more sustainable and there's more trust that goes in it. So really profound things. Thank you so much, Lindsay. Thank you, Stephanie.
Thank you.
For providing that. And both of you have a wonderful holiday. All righty. Well, let's move now to our next slide. And this again is a reminder of the Crisis Jam debate number 2. Which is scheduled for January 24th of 2024. We are talking about Sabrina Taylor being on the pro side and Dr. Jen Stuber being on the side that is anti. So this is something that has proven itself already to be a phenomenal connections to make. So guys, be sure to be connected with this. Again, about crisis care shouldn't come in a police car. We've said this statement over and over again, but it will be fascinating to kind of watch the perspectives because they can be helpful, I think, to yourselves and to the communities going forward about some of the thoughts that are actually out there. Next slide, please. Okay, I do want to just spend a moment again to remind everyone that we are not going to be having a crisis jam. So I have the pleasure of closing out 2023 with you today. We will not have a crisis jam for the next 3 weeks. The next time that it is actually scheduled to begin again will be on January 10th of 2024. So as we have the holiday break, just a reminder to, if you have time, review over any of the previous episodes you may not have seen, give yourself some opportunity to catch up on some things. I do want to point out also that we're having the next Crisis Jam, the episode 156 on Behave, the biology of humans at our best and our worst, by Dr. Robert Sapolsky. And we're really looking forward to that on January the 10th. So to all of you, I thank you so much for connecting with us on this Crisis Jam. And I do want to wish each and every one of you the best of holidays. Happy holidays to each and every one of you. Be safe, connect, do those collaborations and those family things that we need to do to just show us all join together. And we'll connect again on January 10th. So everyone be safe. Have a pleasant holiday.